everybody. I'll just be brief, but I'm happy to take any questions that arise. As most of you know, we have been preparing for this since we first learned of it. We had multiple meetings before Mardi Gras to plan, and now that Mardi Gras is done, and the virus appears to have spread to the U.S., and that means we've just ramped up our efforts. We are in daily contact with the Louisiana Department of Health. We have weekly calls with the CDC and are monitoring all of the health organizations, national and international, very closely. We have, again, as Bo said, been in contact with multiple business leaders, tourism leaders, the schools. Not only are we planning a tabletop exercise to run through some potential scenarios on Friday, but we're also presenting information to City Council about COVID-19 on Thursday. And then there will be some future meetings of various sector leaders to make sure that everyone is on the same page. Everyone can understand how this may or may not affect their particular business, their particular organization, and so that we're as transparent as possible. Right now, there remains 0 cases confirmed in Louisiana. The State Department of Health does have the ability to test for the virus, and that's been for the last couple of days. Those are the testing kits from the CDC. They are up and running. They're working well. There's a very good turnaround time with those tests. We're also in contact with our healthcare providers and our hospitals. All of them have been meeting very closely, redoing their emergency plans. And so we are as prepared as we can possibly be.
Dr. Avegno, can you say anything about what are any precautions being taken here at City Hall, for example? Have you all added any sort of cleaning stations? Have you put out advisories to employees? Are you stockpiling any equipment for anything? Can you speak to that, please?
So we are encouraging city employees, just like we encourage everyone, to practice good hand hygiene, to stay home when they're sick. We do have hygiene stations around the city as it is. We are also looking at our own internal policies just to plan out if folks had to work from home, what would we look like? We're doing ourselves what we're going to be asking every other business to do. In terms of stockpiling, we have a supply ready for emergencies of PPE. We are looking at that and seeing how much more we might need. As you probably know, supplies are very, very limited nationwide and internationally because of COVID-19. We are asking folks, just as the Surgeon General and every other major organization is, to not go out and buy a box of surgical masks, not to go out and hoard, Purell or soap. There's plenty enough for everyone. Everyone has to be prepared and do what's necessary for them, but at this point, there's no reason for that.
What's a PCE?
PPE, sorry, personal protective equipment.
What, besides washing hands and possibly wearing a mask, is there anything else people should be doing? And I ask this because it's like, you see what's going on in Seattle right now, where there is a sense of panic in that state, in that city. Should people get water, canned food? It should almost be like hurricane preparedness, where they should prepare in case they may have to work from home or stay home. Is there anything that people should be doing besides what you just said?
So you bring up a really good comparison. I think in New Orleans, we are probably better at knowing how to prepare than anywhere else in the country because we have to do it on a yearly basis. So if you don't have a regular disaster plan that you look at every year for hurricane season, now's the time to make one. It's one that can be easily adaptable for this kind of situation. So yes, we're asking folks to make sure you have enough medications that could last you for 30 days. That's a good rule of thumb anyway. We're also asking folks to check on their vulnerable family, friends, and neighbors, because while we don't know everything about this outbreak, we do know that it appears to be affecting elderly individuals and those with chronic medical conditions. And so those we would expect to be the ones hardest hit. So once you've got your own plan straight, we really encourage you to check on that elderly neighbor, make sure they have an extra supply of their prescriptions, make sure they're included in somebody's plans just in case this does come to us as it's now hitting Seattle.
Are there any cases in the city or the greater New Orleans area that are being evaluated for coronavirus?
As of today, no, not that I've heard.
And I think one concern on a lot of people's mind is obviously with Mardi Gras last week and reports that There could have been cases in the States well before that. I mean, I don't know what the right way to ask this question is, but do you think that there's a decent likelihood that there are cases around that we just haven't been symptomatic yet, or haven't been serious enough to be picked up yet?
I think that's certainly what we're seeing in the West Coast. That is the presumption in Seattle, is that the virus had been transmitting for a few weeks, and it took some time to get from person A to person B. And so we really don't know what the extent of that. It is not unreasonable to think that it has been circulating wider than that from now. And again, the thing about this virus is that most people are going to have very mild symptoms, or feel like it's a bad cold. And so it's not things that people would necessarily go to a doctor or go to a hospital for. Right now, the CDC is not advocating testing for everybody who has a fever and a cough, because we're in the middle of flu season, and we just simply don't have that's not necessary at this time.
That was going to happen.
You called it.
So
You can just throw it on the top of the podium.
So that is definitely a possibility.
That's perfect.
And again, we're just watching and waiting, not only what's going on in the Northwest, but also for what may come here.
Rob, can you say if the city has any extra observers or inspectors or anything going on at the cruise ship terminal or at the airport?
So the cruise ships actually that are quite heavily watched, or observed, I should say. That's something that's coming out of the Coast Guard. And the CDC. They work really closely together. People don't realize that it's not uncommon at all for cruise ships to get a suspected case of measles on board, or a norovirus outbreak. And there's a very well-defined procedure for those that they're using for this. They are tracking the ports of entry of every ship that comes in and out of every port back to at least the 5th previous port, as well as the passengers. So if there is something that starts on a cruise ship, they will know about it well in advance of it docking. And again, there's protocols established for them to enact if necessary. As of yet, we have not heard anything coming out of the port or a cruise ship. And we're in close communication with our port partners and our Coast Guard partners. They'll be there at the tabletop exercise as well.
Any other questions?
For both.